Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
On issue we talked about last week, which is the fact that strokes are rising by 50% and that almost 10 million deaths from stroke. And the article is on 6 ways to reduce the risk of stroke. And I guess one of the most important ways is to control your blood pressure. One of the things that we notice as we go into the community is that most of the patients who have high blood pressure are patients who know that they have high blood pressure, but they don't take their medicine appropriately. And they don't follow up their blood pressure by taking their blood pressures at home frequently. So one of the most important things to do is to take your medicine and also take your blood pressure at home and make sure that it's less than 140/90. That's the maximum you want it to be. And then, of course, we talked ad nauseum about physical exercise and the importance of that. And then, of course, nutrition. We do talk about that as well. One thing we don't talk much about is avoiding air pollution, because that's one of the things that is hardest for us to do unless you have the right exhaust fans and ventilation in your house. When you go outside, then pollution can address it. Now, the other problem is the cause of stress, which I think meditation is one of the ways, and is one of the ways to control stress, because that's the other issue. And then, of course, recognizing the signs of a mini stroke, which is often the preliminary episode to a major stroke, is something. And so they emphasize the fast, that if you have drooping on the face, arm weakness, speech difficulty, or go blind, it's time to call 911. Or if you have numbness of the face and arm, or very severe headache, then you should go to the hospital immediately, because it's thought that you lose about 1 million brain cells a minute if you have a stroke. So the sooner you get to the hospital and they are able to do those things that can eliminate the clot if it's a clot, and minimize lower the blood pressure so you stop bleeding, the better off you'll be. But I think it's a very interesting article. There's also an article on those golfers of you and how to use a golf stroke that will not hurt your back. Anyway, those are 2 of the things in the Washington Post that I thought you might want to look at. Okay, we can show the first presentation, unless you have questions about any of that. Yeah, this is a wonderful article in the sense that it's over a month now, and the big heart transplant worked, and so it all goes well for the future of heart transplants, with the donors being pigs. And so this is perhaps the beginning of what will become common in the next decade. Xenotransplantation is the name of it, or heterografts. And it's something that we haven't done successfully really ever. And so this is occurring because of the fact that they're able to change the genotype of the pig and eliminate that antigen that was in the pig that made it likely to have rejection whenever waiting for transplants. And so this is something that is wonderful. Oh, wow. Any questions or comments? Oh, boy. Okay. No comments, huh? Okay. Well, let's go to the next one then.
One comment, Dr. Callender.
Yeah.
Uh, of all the transplants, the first one that was most important one was the heart, I think, and then so I believe doctors concentrated on that one more so, how to get that one transplanted. And now that the pig's heart is working, maybe they're going to move on to other organs now.
Well, I think yeah, they already, as we mentioned last week, they already doing it in the kidneys as well, but it just hasn't gotten to the stage as far advanced as it is with the heart. With the kidney, they've only uh, done it with donors who have are brain dead, and they have put the pig kidneys into them, and they have seen no sign of rejection so far either. But they have not yet gotten to the point where they have somebody who actually uh, needs a kidney transplant. And so that's down the road. But I think the successful heart transplant will open the door for that as well. Well, we had talked about last week also about the fact that because you're in a coma doesn't mean you can't hear people. And here's somebody. I know many people who have been in a coma and recovered. And this lady had lupus erythematosus, and yeah, and she was near death. As lupus, it's one of the diseases that affects every organ system in the body potentially, and is an autoimmune disease that has killed many people. It's particularly common in Black women, uh, and sometimes as a consequence, you can lose consciousness and, of course, die. And this lady was in a coma, had encephalitis, and it's an autoimmune disease. We talked about last week also about how we have antibodies that are there to protect us from uh, foreign bodies, but we also have autoantibodies, antibodies within us that attack our own tissues. And this is lupus erythematosus is a situation like that in which you have your own antibodies attacking the different parts of the body, and as a consequence, it attacks almost every organ system in the body. But it's often very responsive to steroids uh, and other medications that were used for transplantation as well. Anyway, uh, even though that they thought she was in a persistent vegetative state, which is a situation which many people do not recover from, but is not, I emphasize, is not the same as brain death, but it's brain injury and brain damage. And so over time, the brain swelling reduced, and it got to the point where she became responsive and awoke from her coma. So this is interesting. Now remember, we had a case just a couple of, I guess, couple of maybe a month ago, in which we talked about a lady who was in a schizophrenic state, and she, they finally diagnosed that she had lupus, and they treated her with steroids, and she woke up. And this then is another case in which people have responded to treatment for this disease. We've had a number of kidney transplants in patients who had lupus erythematosus. And as a matter of fact, Cheryl Jones had her kidney had lupus for 30 years. So
I've got a comment. If you notice that picture, the lady has hair relaxer. I'm reading from the internet that said some years ago there was a controversial research paper that suggested that uh, hair dyes and hair relaxer cause lupus. However, subsequent studies have not confirmed this. I know it's anecdotal, but when you say that it's mostly black people and three times as many black women, well, black women relax their hair.
Only
okay.
except Daryl, she has a wig on. I know men can't tell, but
Oh,
that's not her natural hair.
all right. Yeah, you're right. Men can't. Well, at least I can't.
I mean, sometimes I'm in the choir and I'll ask John, how many of the ladies you think actually have wigs on? And he can't probably tell.
Yeah.
Because black
There's a,
women, we have all sorts of hairstyles, but generally, we all know who has a wig on, a hairpiece, or glued in and whatever. Betty's
okay.
shaking her head, yes, but we know, but I don't know why you men are fooled.
Well, there's a black woman I work with who has lupus, and she was always diligent over the years about having her hair with a permanent. And I could tell it was a permanent and not a wig because she wore her hair short. And you could see the kitchen, and uh, there was no meshing of a wig with her. It was her real hair. You could tell. You could see the scalp, the roots. So that this one lady with lupus and a permanent, that proves it for me.
It's nice to see. This is another article that is kind of scary because a lot of people eat fish that is not cooked at all. But anyway, this lady had a fish that was undercooked and had bacteria that was toxic to her that caused her to have septicemia, and so bad that she actually lost her limbs. And it's one of the things that uncooked seafood can be associated with. So this isn't something that you'd like to see, but they say that it's commonly found in raw seafood, uh, and this bacteria causes 80,000 illnesses each year. And you see what it says here? It recommends washing hands after handling raw shellfish and cooking oysters or other shellfish before eating them. I don't know of many examples of this kind of situation, but there's so many people nowadays who prefer raw oysters and fish. So
Dr. Callender,
anyway,
is that real hair? This girl named Laura, is that her real hair, Dr. Callender?
say again?
Is that her real hair?
I don't know.
Um, I'm. Is it sushi raw fish?
Yes.
Okay.
Kamshi. Yeah.
All right.
Sushi and kamshi.
I eat it all the time. I also eat raw oysters on the half shell a lot. And I like sushi. So I don't know if I'm going to change my behavior, but that that is scary.
Then what good is this information if you're not going to change?
He doesn't have a wig.
It's still up to you, you know.
He doesn't have a wig though.
Come on, John.
So, how does washing your hands have anything to do with what's inside of the raw fish?
Well, they're talking about people who are going to then, uh, you know, fry the fish or do whatever. They're not talking about those people who are going to eat the fish because they only talking about those people who are going to prepare the shellfish and then go on and boil it or fry it or roast it or whatever. Those people can get it from handling, get the bacteria in their hands from handling the fish. That's what they're talking about.
Okay.
If you're going to eat it, that's another story because you're vulnerable like this lady was. Yeah.
Also, Dr. Callender, that bacteria is the same one they found in the remember the seaweed that was coming up on the beach in Florida and all, Vibrio.
Yes.
That's the same
Yes.
one.
Yeah. Okay. Well, that's just word to the wise is sufficient. So,
Did
and
it have a
this
name
is
for that bacteria?
what's that?
Is there a name for that particular
Yeah,
bacteria?
Vibrio. I mean, but Vibrio is a big family, though. It's a family of bacteria that are dangerous. Now, this is a virus that causes dengue fever, which is often spread by mosquito bites that we don't see very often in the United States. So, and mosquito breeding is not something that we see as much in the United States, but in many other countries. As we know, malaria is transmitted by the mosquito, and it's one of the commonest causes of death in the world. And this is another mosquito that carries dengue fever, which we don't see. You can see here it's pretty uncommon unless people have been outside of the United States. Says with fever, headache, body aches, nausea, and a rash. Can be fatal, but is not common.
Dr. Callender, as an aside, dengue was the real reason that the scientists, the immunologists, started to study the messenger RNA treatment um, for infections, and the technology that they developed is where the messenger RNA vaccines came from, and that was like maybe 15 years ago when it first came up, and it was in Central America, and it started to show up like in Florida, but they caught it early enough, to prevent it from spreading, and they came up with a vaccine for it. But this is where, and the scientists were in California as well that developed that technology where they use the computer to break down the genetic code of the virus, and then
Right.
they matched an anti. Uh, they recognized the surface structure of that virus, and then figured out a way to counter it with messenger RNA.
Right, and they just got the Nobel Prize for that work just this month. So, okay, this next one. Well, this is interesting that we're back to doing this again, and as you know, as long as the people who are infected with the virus uh, know what they're doing when they have these treatments, it's okay because you have to have informed consent, and so this is a virus for which there is no vaccine, and so they're trying to identify a way to overcome this viral infection, which is spread also by mosquitoes. And it of course reminds me of the way they used to do it in terms of getting volunteers who really didn't know what they were getting. And so as long as the volunteers are actually informed and they know the risks, then this kind of research is okay. As many of you have been involved in research for different vaccines, the RSV vaccine and others. And one of the problems in the past actually had been that didn't have as many. Of course, first, most of the research was done in men and not women. And then when they started doing women, they left out minorities, people of color like Native Americans, Indian, and African Americans. So we still have a scarcity of people of color being used for research, although that was not the case with the with COVID, because they overly expressed the number of minorities in this case because of the past history. So I think as we go on, we'll have even more vaccines, and we'll have more people of color that are actually involved in this. And that's the way it should be. Any comments or thoughts about that? It's interesting why you should never wear socks in bed. Interesting because you don't find many people who actually do wear socks in bed, and the reason they are concerned about is the germs that you put on your sheets, and because dust mites. Any of you actually wear socks at night to go when you go to bed?
My husband does.
Yeah, well, they're suggesting that it's very germy to do it, and you bring all kinds of bacteria with you, and you do that.
I'm having him take note of this article.
What's that, Betty?
I'm having him take note of this article.
My feet get cold.
He says his feet get cold. That's why he wears his socks.
I see.
It seems to me like the article was talking about people that wore the socks morning till night, and those socks they wore all day, they wore to bed. But if they
Right.
put on they put on fresh socks and only to go to sleep. Took
That's
the socks off when they wake up. That to me doesn't seem to be a problem.
that's different. The question is that what your husband does? Or is this the same
Think so.
socks? It's the same socks he wears around the day.
He
Yeah,
said
because
that's a lot of washing for me to do that.
Because most, yeah, I don't know many people who wear socks in bed, but if they wear the same socks they wore all day, then it could be very germy. If they did what Daryl said, then it wouldn't be because they would only be using socks that are clean and haven't accumulated dirt and bacteria.
Good to know.
Yeah, because for foot care, that could be very effective if you put on fresh socks. Well, if you lotion or put moisturizer or shea butter on your feet and then put on fresh socks, it lets your feet kind of moisturize during the night. Um, then you wash the socks.
That's the key, though. Yeah. Okay. Well, it doesn't seem like too many people do that. Only Betty's husband admits it anyway. Yeah. This is something that Darrell talked to us about being a marathon person, and this guy died right after winning a cross country race. But Darrell said that in almost every marathon that he participated in, at least one person died. What is remarkable about this is the age of the person. He's 16 years older. And so, of course, they named him Athlete of the Weekend. I don't think that helps his family or him. But, and we've talked about the sudden cardiac arrest, leading cause of sport-related death, competitive athletes. They mentioned Brownie James and actually Shaquille O'Neal's son as well had the same thing.
Dr. Callender, had a question. Is there anything they can do in advance of participation in sports to recognize the possibility or
Yeah, there are tests. I think in the article that we discussed about a month ago, there are tests that they could do, but they may be expensive and they don't do them. They can do ultrasounds and other special cardiac studies that could identify morphologies. They could identify defects in the heart and rhythms that are abnormal in the heart. So the question is, why don't we do it then? Because yeah, there are ways of doing it, but
Yeah, and like things like stress tests, the sonograms, um, and if there are defects found, to do things like cardiac MRIs.
yeah, all of those are expensive, and so to do that for everyone would be prohibitive. But that is what it would require to find out about it, and so there hasn't been much talk of making that available for all athletes uh, because the cost might be thought by many to be prohibitive.
Yeah.
But we're having so many of them, it makes you wonder.
Yeah, the cross country can be dangerous because it's only 5K, which is 3.1 miles. And so for a lot of runners, it's a sprint. And you can run it anaerobically, which means that you're not running it aerobically, you're running it with the oxygen debt. And so when you start to do some mouth breathing because you can't get enough oxygen through your nose, that's when your heart rate can get into the danger zone. And that's where you get into the cardiac arrest. So a lot of runners don't run with a heart monitor, uh, so that they can get an alert when they go over their red line. For most people, the red line. For older people, it's going to be around 140. For a kid, it might be 150, but shouldn't exceed your red line regardless of age, because that's where you can get into cardiac arrest.
What are those numbers, Daryl? What is the 140 and 150? What do they represent?
Heart rate.
Heart rate.
Heart rate. Okay. Beats per minute?
Beats per
Yeah.
minute.
Okay. All right.
Okay, I have a question. What sport is the safest sport for a person? Because we know football isn't.
Bowling.
Probably
Curling.
checkers.
I'd say curling.
Golf is okay.
What else?
Curling.
Maybe table tennis, maybe. I don't know. You haven't seen anybody collapsing from that, but all these other sports have their risks. But just as Dal had said in the past, those marathons and basketball, wow.
And cleaning the house.
I haven't heard of people dropping dead cleaning the house.
That's not
right,
a
but
sport.
that's a form of exercise.
Oh yeah, it's a form of exercise, but I hadn't heard it was dangerous though.
Right, it's not dangerous, and neither is gardening.
Yeah, both of those are very, very
so
good.
Things that you do that you're supposed to do naturally, but when you start doing things that are not natural to not to live just for fun and sports, that's where we get into trouble. If we just stick to the mundane, cleaning the house, gardening, farming, and all that kind of stuff, we'll be fine and we'll still be exercising.
Not as exciting.
Well, the history of team sports has always been military training, conditioning minds and bodies for eventually being in the military.
Well, this is a feel-good story about a heart doctor who was relaxing a bit on vacation, and somebody car hit somebody's husband, and saw blood running out of the underneath the car, and the gentleman collapsed, and there was a young man who was bleeding, and the heart doctor went over and put pressure on the bleeding point, and was able to stop the guy's bleeding. Of course, we have a new initiative that actually does just that. You put a tourniquet around somebody, and the long and short of the story was, as a consequence, the guy did not bleed to death, and they were able to resuscitate him, take him to the hospital, and repair his blood vessel that was ruptured. And as a consequence, he survived. There is a new initiative that is going across the country, which allows people to have tourniquets they can use to stop the bleeding, is the name of the initiative. And they do what this guy did with his hand, which is to put pressure over the bleeding vessel and stop the bleeding. And it has saved many lives. It's a freak accident in a sense, but he got caught between two cars. And the woman released the parking brake without having a foot on the brake. And it happened like that. So many accidents that can just happen. But it's great that they called the doctor and he went over and put pressure and stopped the bleeding. Any comments or thoughts about this? You know, it's interesting that things like that may happen every day, and it's not that often that you get positive press out of it. But it's a kind of thing where we help each other and think nothing of it because we love each other and care for each other. And so you don't do this for good press. You do this because you just want to help your brother or sister. And so it's nice to have articles that talk about the things that we do often that aren't captured in the press. There's so much negative press. It's the positive things that we do really are publicized often enough. Now, people who play board games, it's interesting. We're still alleging that slows cognitive decline. Chess and checkers and other board games seem to delay the onset of Alzheimer's and dementia. The question is, how often should you be playing this? And here they suggest once or twice a week. How many of you play games like chess and checkers and those kinds of board games?
I play chess every day online, and I was telling Carol that I won 6 games in a row, and then I lost one. So it's almost like an ebb and flow. But yeah, I play every day.
Solitaire count?
What's that, Betty?
The solitaire count?
Oh, solitaire. Oh.
No.
Betty, I was hoping that I would receive a yes on that.
You receive one from me because as fast as you play that game, the speed that you shuffle those cards and stuff, I think you're really increasing your cognitive ability.
Okay, Betty, you hear that?
Yeah, I heard it. I play it daily.
I know, but the pros said no. But anyway.
Mm-hmm.
I'm not a pro. I just said no because solitaire is an addiction. It's like nicotine.
Yes.
No, it's not.
Yes. Yes.
No, I don't play as much solitaire as my husband stays on Facebook. Okay. So it's not an addiction.
Well, no, solitaire is an addiction, but Facebook is like crack cocaine.
Yes, it is.
I play Sudoku.
That's interesting.
What about Pacino?
That counts.
That counts. Okay. I also play Pacino.
Yeah, I play Sudoku.
That counts.
That counts.
These are all board games, huh?
Yeah.
Yeah.
My favorite card game is Dirty, Filthy Hearts.
Oh, yeah. Dirty Hearts. Oh, yeah.
With or without the drinking?
Has nothing to do with drinking.
Nothing to do with
Well, that was the penalty for losing.
Is drinking?
Scrabble.
Yeah.
Scrabble is a good game. I don't play it because my wife is a Scrabble shark and I can't beat her.
What about Uno?
No.
Oh,
What is Uno?
Card game.
Oh, it's
Card
called
game.
Our game. We played
Takes-
when we were in
It
Chicago.
takes no skill.
no, it doesn't take skill. It's luck. It's more luck than skill.
What about Bid Whisk?
I said whist. Yeah. Whist. Whist should
Pinochle,
be knuckle.
Spades.
Oh,
Okay, stop going down the list.
Cool.
Well, this is an interesting article because not too many people recognize that dads get postpartum depression too. Although we now, the fathers get time off too for pregnancy, just as the women do. So we've come a long way, but 8 to 13% of new fathers has postpartum depression. It's kind of shocking to me, but how many, any of you have encountered that?
no.
No, I really don't believe this article.
I'm with you, Carol.
Or maybe I'm just of the generation. It used to be they wouldn't even let men in the delivery room, but now they do, and everybody's up in there. But and it used to be, well, maybe it could be because men are taking care more of babies than women. But ours was hormonal of what your body is going through after childbirth and everything. What are their bodies going through?
They're going through depression because of lack of sex and lack of attention because the woman is spending time with the child instead of the man.
Oh, now I can understand that.
Well, that's what it's all about.
No, you can't.
They should name that something else. It shouldn't be
Yeah.
postpartum depression.
And I guess, but it
He's
is.
depressed
It's
'cause-
postpartum. It occurs after the delivery, so the
Yeah.
term is appropriate.
The cure for dad's postpartum depression is having an affair.
I told my son.
And Dr. Callender, you're laughing at that?
Yeah, but
funny.
that's kind of a lethal solution.
That opens
It's
up
been
a
a lethal-
whole new
Yeah.
bag of worms.
That was
that's
a historical.
one problem for another one.
Yeah.
Yeah.
I'm just saying that's historically how a lot of men have cured the depression.
I'm good.
I agree with that.
Well, that hasn't been studied yet, but that may well be true.
Yeah, but they can also get killed.
Right.
That'll end the depression.
Yeah, that ends everything.
Yeah.
That's only if she finds out.
Well, the safe cure would be for the man to focus on board games.
Okay, I want to try this. This is a
Okay.
video link, and I'm going to see if we can make it work.
Okay, yeah. Those of you who go to the movies would know who Maria Menounos is, because they have her prominently featured in all of that. But she also had another cancer. I believe she had a brain cancer that was picked up and early and treated. Didn't work, huh?
I'm going to have to try something else. Hang on.
That's her.
It looks like you can't hear it.
No. Did you
Okay.
turn video?
Yeah, I did. Let's see. Okay, I'm gonna stop it.
Okay. Well, what one of the most deadly cancers there is actually pancreatic cancer. And the 5-year survival is probably closer to 20%. And and often the only symptom that you have pancreatic cancer is back pain, or if you sometimes you can have jaundice where your eyes turn yellow. But often the symptoms don't occur until it's far advanced. But any kind of abdominal pain or back pain can often be the earliest symptom of pancreatic cancer, which would then require specific x-rays and other pictures of the pancreas to see if you have a tumor in the pancreas. And if you do have an early cancer, it can be surgically removed. And that's, but more often than not, the symptoms of pancreatic cancer are not appreciated until it's too late. And once it's spread, there is no cure for that, as far as we know.
Dr. Callender, do they remove the tumor or do they remove the whole pancreas?
It depends on often it just takes out the part of the pancreas that has the tumor if it's early. And so they do a partial pancreatectomy. And it can be curative if the tumor is confined to the pancreas. If it is spread, then it's another story. But I think it's very important if you have pain, abdominal pain of any kind, or back pain, for which there's no diagnosis. In other words, there's no spinal stenosis or disc, something like that. Then you should look to get special X-rays of the pancreas to see if you have pancreatic cancer. Because right now it is one of the deadliest of the cancers that we have. Okay, sorry we couldn't show that.
I put the link in the chat, so if you want to, click on it and save it for later, you can watch that video offline. All right.
Okay, any other questions about pancreatic cancer?
Dr. Callender, in 1978, they told my mother-in-law that it was in her mind, the doctor, and she was complaining. She did have jaundice and everything. And it wasn't until they did the surgery in June that they found out that she had pancreatic cancer.
She had jaundice?
Yes. And the doctor told her that the symptoms that she was experiencing was in her mind, worry over her children. And, that was a misdiagnosis. But I was
worrying about your children doesn't cause you to have jaundice.
Right. But he somehow did that. And I was talking to her and I said, no, that couldn't possibly be it. But, and I was sort of upset. I didn't know that pancreatic cancer was that, she lived 3 months after the diagnosis, after the surgery.
Yeah, Richard Roundtree just died from pancreatic cancer. He lived 2 months after they made his diagnosis.
So do doctors really know what they're looking for, or is that just one of those illnesses that they just hit and miss?
Well, if you catch it early, just like this lady, if you have jaundice, that's a sign that you could have an early pancreatic cancer. Or if you have back pain or any kind of abdominal pain and you get MRIs of the pancreas, you can make the diagnosis of an early pancreatic cancer, which potentially is curable. But if it's spread already, or if it's very large and spread to the lymph nodes or to the other areas, then it's relatively incurable. So an early diagnosis is the key to treating it successfully.
Yet, Dr. Callender, the other thing was that when she turned jaundice, their first diagnosis was liver failure.
Well, that must have been a long time ago, huh?
1977, 78.
Oh, okay. Well, well, nowadays they would make a diagnosis, but we have more techniques now. We have CAT scans, MRIs that make it easier to make the diagnosis. And 78, they didn't have all of that. And, so that may be why.
So, Dr. Callender, if you have a regular physical, would anything show up on your blood testing that would indicate nothing?
No, no, no. You have to have a high suspicion index. And if they have back pain or abdominal pain that is not due to a known cause, then you've got to look for it. And you've got to do the special studies to find out whether the pancreas is involved or not. Jaundice is an obvious sign of pancreatic cancer. But it can also be a sign of liver disease. But you do the studies to differentiate between the liver disease and the pancreas. And the MRI is a good way of making the diagnosis of pancreatic cancer. But a high index of suspicion if you have abdominal pain, back pain, or of course if you have jaundice, it's another reason. Yeah. Now this is an article I thought was important because sometimes people don't recognize that cleaning your teeth is one of the best ways you can of preventing heart disease. And we have a lot of bacteria in the mouth, and these bacteria may result in the long term in heart trouble, heart disease, and even heart attacks. And so they did studies that identified that often the source of these heart conditions were related to gingivitis and bacteria in the oral cavity. So flossing daily and brushing your teeth twice a day and flossing becomes an important way of protecting your heart. And that's what this article is all about. Sometimes people don't realize that brushing your teeth, flossing twice a day is a good way to prevent heart disease and heart attacks. It's oral health care is an ounce of prevention here is worth a pound of cure. And by flossing and doing it at least twice a day, it's a good way of reducing the likelihood of gingivitis. Any comments or questions about this?
Now with a People magazine Today exclusive, longtime entertainment journalist Maria Menounos is opening up about her health battle. Maria has accomplished a lot in her 44 years.
Carol, we're listening to you. Okay.
Any comment about the dental care article? So it means everybody's doing that, so it's not a problem. Okay. Now, this is one of the things that we don't discuss. We talk about colorectal cancer screening, but we don't talk about why people don't get colorectal cancer screening. And one of the lesser discussed aspects is actually the prep, the bowel prep that you get. But this study says only 60% of adults actually get screened for cancer. And colorectal cancer is thought of as a preventable disease. And so they did a study to find out why. And only 46% had even had a fecal occult blood test or a colonoscopy in the last 5 years. And of course, they looked at the first thing is fear, worry that if they go to sleep, they won't wake up for a colonoscopy. But of course, a fecal occult blood test that's nothing to worry about. Lack of provider referral or recommendation means that the doctor didn't recommend it, which is a failure on the part of the physician, because we think all adults over 45 should have colorectal screening. Lack of health insurance is something that remains a problem, although this is particularly those who are not Medicaid eligible, and so you got a group of people in between the people who can't afford insurance and those who can. And so this middle group will have financial difficulties. And then people who just don't have time, don't take time to be healthy. And it's kind of a tough one, but it exists nonetheless. Now, as what is expected, 50% higher in Black people than white. Blacks and Hispanics were likely to be undertreated as well. One of the most important thing is the healthcare provider. And because many of them still don't tell their patients that they need to get colonoscopy at the age of 45. They will see them for other conditions and not take advantage of that to let them know that they need to have a colonoscopy. And I think that is one of the major roles that, even I participated in the Freedman's Clinic, which takes care of people who don't have health insurance. And most of them have never had colonoscopies. And so the lack of insurance. So here again, the fact that we don't have universal health insurance is an obstacle to good health. However, I do think that one of the major factors is the healthcare provider. And one of the things that you can do is if you live in DC, it's pretty difficult not to qualify for Medicaid. So most people can qualify for Medicaid, and that will give you insurance. But people who live in Maryland and other places may not be as fortunate to be able to get Maryland, because there is a Maryland Medicaid, there's DC Medicaid as well. So, but if nobody ever mentions it to you, and you're not informed about the importance of colorectal screening, then you don't take advantage of it. How many of you have had colonoscopies or fecal occult blood tests?
Yes, I've had it. We also had a friend that had his colonoscopy and did not wake up. He passed away.
Really?
Yes, that was about 20 years ago. So he was probably in his late 40s or early 50s. Of course, we never found out what the problem was, but he seemed to be healthy. But
that's scary.
yeah.
And there have been patients who've had colonoscopy who did wake up but had complications thereafter. They are very infrequent, but they occur.
Dr. Callender,
That's the fear and worry part of it. Yes.
That person that Betty was talking about, do you ever think it's related to the anesthesia? You know, don't they have to use anesthesia according to their body weight?
Well, it's anesthesia. You know, most of the anesthesia they give for colonoscopy is very minimal. You know, they very light sedation, and it's unlikely that is the cause, but it's possible. It's extremely unlikely, though, especially nowadays. I don't know what they were doing 20 years ago. Things have changed a lot in the last 20 years, and they may have been doing it under anesthesia then. Now it's very light anesthesia that and 20 years ago they may have been using general anesthesia, which is different.
You know, I mentioned before that when my first colonoscopy, I asked not to be put to sleep. And I think at that time I was kind of apprehensive about going to sleep. But since then I have, changed. But the very first time I did a colonoscopy, I didn't want to be put to sleep.
Any other comments? If not, yeah, go ahead.
Is there pain with colonoscopy? I mean, why do they put you to sleep?
It's uncomfortable. It can be uncomfortable. Most of my colonoscopies, I welcome the opportunity to sleep and wake up after it was done. But some people still, so it's not that it's painful, it's uncomfortable for some.
No, it wasn't painful to me. Matter of fact, I watched it on the screen. So it's kind of an adventure.
Yeah, my first colonoscopy was without anesthesia, and it wasn't painful. It was just uncomfortable. I watched it on the screen too.
Mm-hmm. Mm-hmm.
Yeah, I watched mine as well. The anesthesia is to keep your sphincter from closing up and seizing. So you have it. The muscles have to be relaxed in order for the camera to get all the way up and around.
This article is about a lady who got a vaccine after having a diagnosis of breast cancer. And the 3-dose series is a vaccine that's part of a study that was hoped that would prevent her from having recurrence of the cancer. So she's been in remission for 5 years. That doesn't really say that the vaccine worked, but it's anecdotal, and you've got a lot more work to do to say that she's not recurring because of the vaccine. But it's anyway, it's an article that suggests that this is something that may come to pass. But it's far too early to say. But anyway, it's just the fact that she had it, she believes that it worked. But research, as you know, you have phase 1, phase 2, and phase 3 research trials. And this is not meant to say that we have actually discovered that this vaccine will work. But anyway, it's just to know that It has been done in Cleveland Clinic, and time will tell whether it's really effective or not. One case does not, one swallow does not a season make, they say. So,
Dr. Callender, can you explain what do you mean by triple negative cancer?
yeah, well, they have estrogen negative, progesterone negative, and there's another one. That means that the likelihood uh, of you responding to those medications is good. Whereas if you're positive, then the likelihood of you responding to those, for example, progesterone and estrogen are part of the treatment for uh, early cancers, breast cancers. And so those people who do not have those receptors are likely to they're likely to have recurrences, and that's why they gave her the vaccine. It's just that, and when you go to have if you have breast cancer, they look for progesterone receptor sites, estrogen receptor sites, and I forget there's another receptor site. And if you're triple negative, that means you don't have those receptor sites, and that you are not going to be able to respond to those treatments. Now, this shot is supposed to produce the protein that you're lacking, but whether it works or not, I think it's a tall order to say unless you do it in a number of patients. Here we have one patient. So if we had done this in 1,000 patients, then we would have a reason to cheer. But I think it's far too early.
In a previous slide, I saw that she was getting the vaccine in her stomach.
I don't know where she was getting the vaccine.
Well, I thought that's what I saw right there. Okay. So they didn't put it in her arm. So that's the way she didn't feel it as much.
I can't answer that question because it doesn't say that she's receiving the vaccine in the stomach.
Well, that needle is going in her stomach, isn't it?
Right, but I don't know what that means. It doesn't, the label doesn't answer the question. You could be right, but that's a guess. If their label is saying that she was receiving the vaccine in her stomach, then that would clinch it. But they don't. They show that, and the impression. To me, you can get a vaccine anywhere you want: stomach, shoulder, or butt.
Just her preference.
Right. And many people think that the abdomen has got a lot of fat, so it's a good place to give it. Butt has a lot of fat too. Good place to give it.
But some people have a disease.
Say again?
Some people have a disease called no acetol.
Oh, thank you, Carol. Most people have enough stomach, so
I thought it was a guy thing, Carol.
So many women are dying of breast cancer. It's alarming and frightening. I have so many of my female colleagues, surgical colleagues, who died from breast cancer.
Yeah.
It's really
John Buchanan, I see that you highlighted that 15 women were in that study. Is that correct?
Yes.
But that's not enough for me.
Yeah, it's still not enough, but it was more
No,
than
not even close.
No.
So, but it's food for, it gives you hope that in the near future we will get to the point where we have a vaccine to prevent cancer. We still don't know what causes cancer. We have a good idea about the role that our immune system plays in allowing it to to survive in our bodies, but we really don't know what is the cause of cancer. And hopefully that'll be one of the things that we learn as we proceed. But we certainly know that our immune system has the ability to eliminate it. Now, this is kind of scary that this would be the cost of Paxlovid when the government no longer pays for the treatment. $1,390, $190 per course. It's kind of expensive if you don't have insurance. And this article points out that this would occur at the end of 2028 if you're uninsured. Now, it's interesting that for Medicare and Medicaid, it will you'll have insurance, but underinsured patients will still be covered through 2028, which is good to see. Have any of you taken Paxlovid? No? Okay. But it is the treatment of choice if your body does not destroy it and the vaccine doesn't allow you to overcome it quickly. But of course, Paxlovid has a number of medications that you cannot take while you're taking Paxlovid. So some people are not eligible for it.
You would only take that anyway if you have had COVID or have COVID. Is that correct?
If you have COVID and it does not respond to treatment, does not respond, if your antibodies do not knock it out within 3 days.
Okay.
And some people feel that if you're over 65, if you have symptoms for any length of time, that you should take Paxlovid.
Fortunately.
Any of you taking Paxlovid?
Me.
Okay. One of the things is that it does work.
If they give it to the presidents, you know it works.
Yeah. Okay. Now this is an article that talks about one nurse accidentally overdosed a patient with Dilaudid. We think we have enough protocols that eliminate this from happening, but in spite of the protocols, this patient got a double dose and became unresponsive and had to be rescued. And nowadays, that is never episode. In other words, it should never happen. And so whenever that happens, we have a special procedure to find out why it happened. And because you ought to have a system in place that doesn't allow you to double dose a person. But in spite of the protocol, it happened. And it happened because she didn't scan the vials she used, and that therefore allowed her to give a second dose. She hasn't worked since then, yeah. Does firing the lady help? Medication errors occur. When somebody does that, does that mean they should be fired? What are your thoughts?
Protocols that would prevent that from happening.
They do have protocols, but what is required is that you have to put in the system that you've given medication. She didn't put it in the system.
Okay.
So the protocol was there, but she didn't follow the protocol.
I think maybe a suspension or something. I don't think firing is the answer. Everybody can make a mistake.
Yeah. Especially since it saved her.
I think that she should lose her privileges of administering medicine and go to another job.
So he's saying she should be fired.
No, I'm talking about another job in the same field, but
mistake. They don't lose their jobs, do they?
Okay. Often they do, because if you have a system in place, the system is not used, they often will at least suspend the person. And sometimes, now one of the reasons is often they will have a malpractice lawsuit that will follow, and if you haven't at least disciplined the person, it suggests that you're kind of lax. But Betty's comment is interesting in that all humans make mistakes, which is accurate.
We learned on this call that a doctor amputated the wrong leg of a patient.
That's happened on a number of occasions, right? And yes, that's true. So and it goes to Betty's point that humans make mistakes. What should happen to her? I don't know. That's why I asked some of your thoughts.
This statement here, this is very scary.
And this is accurate.
9,000 people died because of medication.
The second leading cause of death in this country. That's correct. And that's why some people feel that people who make these mistakes should be fired. Actually, you should have systems in place that are infallible. One nurse facing prison time. She got the wrong medication. The patient died. So when your mistakes kill patients, there's a price that is paid. Is this the way it should be? I don't know. I don't know. None of these people. No, it's if somebody was doing it intentionally to hurt somebody, would be one thing. But when they're not doing it intentionally to hurt somebody, they made a mistake. I'm not sure I understand why you put somebody like that in jail, but that's what they did.
Don't nurses have malpractice insurance?
Nurses and doctors, yes.
Okay.
Well, anyway, this is something that is going to be an issue for some time. And most places, when somebody does something like this, they often will get fired. Question is, should they be fired? Certainly. I don't know the answer to that question. It's kind of a question that is legal as well as ethical.
You know, the other thing, Dr. Callender, is a lot of times, if you fire the person, that's one of the things that helps the hospital get off the hook.
Well, you've done the discipline. And I think that's why they do it. Yeah. I think this the last article, Buchanan?
No, I got 5 more.
Yeah, I've got to leave after this one though.
Okay.
This is good. You know, we talked in an article a couple of weeks ago about the online programs that allow you to get medication for cheaper prices. And as you know, there was an issue with insulin where people had to do not get their insulin because couldn't afford to get it. And now GoodRx is going to give insulin for $35, which is wonderful. What that's going to do to Sanofi, I don't know. But since insulin has been on the market for so long, giving you insulin as well, I think that's wonderful that you have an option to pay $35 for insulin. So that's good news. Of course, it also emphasizes the role of the pharmacist in trying to get medication for people who can't afford it. Any comments? We realize that this is something that all diabetics don't take insulin, but many, just about all of the type 1 diabetics take insulin, and about half of the type 2 diabetics take insulin. So you're talking about that number of people. Okay, going to have to leave after this one. Sorry, I have a doctor's appointment myself. So.